Hello and welcome to the presentation. My name is Tommy Golden, and we'll be talking about gender dysphoria. This is an educational piece and more of an awareness presentation. So, what is gender dysphoria? That's a weird word, isn't it? It's a psychological diagnosis that refers to psychological distress that results from a person's identity not aligning with what they're born with, their physical versus their identification, what they feel. So let's talk about what's transgender. Remember, this is something that is not new. Transgenderism has been around for many years. Even as far as we can date back in history, we've had people that were transgendered. The term transgender is not a psychological diagnosis. I think that's important to understand. It refers more to a person that they feel they identify with an opposite sex or no sex that is different from what they were assigned at birth. So let's talk about biological sex. What the world is that? How is it determined? When we are conceived in the womb, chromosomes are starting to develop, hormones are developing, and our anatomy, our body, is beginning to formulate. That is when the biological sex is assigned. Those of you who are religious, this is where God comes into play. Those of you who are scientific, this is where science comes into play. This is where all this chemistry happens. It's a perfect storm. This is where biological sex is assigned. So let's talk about identity, gender identity at that. Gender identity is where a person is born one sex, but they feel a different way. Born male, but I feel female. I identify as a female. Now, again, like I said early in the presentation, they see inward and outward. This is just not an external presentation. They feel it on the inside, but they'll act on the outside. This surfaces a lot during the teenage years. Certain things happen that conflict with their biological side of their sex. During the teenage years, they will feel uncomfortable being identified in a certain role. They prefer a certain thing. If they're male, they may start dressing in dresses. They may start playing with dolls. Things that are not conducive with what society feels that a male should do. They'll start feeling that their body doesn't match what the inside of them that they see. So the identification is something that is huge during the teenage years. So let's talk about what next steps. What do we do next? How can we help a person that may come to you and say, hey, I'm feeling this way? I think cultivating a welcoming therapeutic space. I know that you're not therapists. However, you can do a welcoming space in your own home. Names are powerful. Utilize their pronouns. Ask them what pronouns they would like to be called. Would you know, what I typically do is say, what pronouns do you prefer? When I meet with a client or when I meet with a friend that could be inside of this gender dysphoria or transgenderism. Second, never make assumptions. Just because I wear male's clothing doesn't mean that I am male. You have people that are experiencing gender dysphoria that is still seeking. So they may identify as a female, but still want to be identified in the public as an opposite sex. So this is a very complex mental diagnosis. Lastly, educate yourself. Make sure you get credible sources. The internet is riddled with non-accredited information, if that makes any sense. Now, when you start seeking treatment, make sure that treatment plan is good for your loved one. Make sure that they have comprehensive testing. This is an assessment that will be done at the beginning of therapy. Social transition. Finding local groups that will assist you. Psychological and social support. Again, finding therapeutic person that can offer therapy. Also, therapeutic groups out there. There are support groups. There are groups all over the internet. Ongoing medical and mental health care. This is vital. Um, and lastly, medical interventions. What that looks like is possible sexual reassignment surgery, hormone therapy. And I know that some people are dead set against that. And I respect that. So let's talk about a case study right quick. Here's Alex. Alex recalls feeling different ever since he was a child. He felt increasingly uncomfortable with others developing their sexual organs. Alex has identified as a non binary for the past several years and uses they them pronouns. So, with this information, we can tell that he is uncomfortable in his own skin. He tells you that he would like to be called they or them. This is where it's very difficult for, the younger generation gets it, the older generation, it's hard for them to call someone they or them. It makes them feel, weird, strange. But this is where we can support Alex, getting him the therapy that he needs. When he's gone to a therapist, the therapist will recommend whether medication needs to be given, and then they will go to the professionals that need to assign him medication. He can also follow up with what's called CBT. CBT is cognitive behavioral therapy. This is where it's called talk therapy. You can meet with the therapist and they will discuss Alex's problems. So that would be a great care plan for him. Here are my references.